And again, I'd like to thank everybody for listening in on this. The other thing I'd like to do next would be to kind of go around and kind of take a attendance at who actually is here. We do have a few people on here, which I do appreciate. So let me see, I'm trying to do this. Looks like we have 9 people and then somebody now joining in. So I guess if I call out, and if you could introduce yourself, start with Jennifer.
Yeah. Hi, good morning. I'm Jennifer Layton, and I'm the President and CEO of LTHC Homeless Services.
Okay, thank you. So is had one to ask, is that everybody hearing me? It's okay, or getting an echo?
I can hear you well here.
Okay. And then Bryce.
Good morning, everybody. My name is Bryce Gibson, and I'm the Manager of Development for City Bus.
Okay, thank you, Bryce. And then Hannah.
My name's Hannah Baker, and I'm one of the social workers with Franciscan Hospice Care and Home Care.
Excellent. Thank you for joining us. And then we just have, it says caller 01. There's no name on. Go ahead.
Hi, this is Diana Salazar with Caregiver Companion. I'm the director.
Great. Thank you for joining us.
Glad to be here. Thank you.
Then we have another one that just has a caller 02. And we have Adam.
This is Adam Murphy with the City of Lafayette.
Great, thank you for joining us. And then Sherry.
Hi, Sherry Moore from NAMI, West Central Indiana.
And then Tracy. Okay, it looks like we have Tracy from Hannah Community Center. And I'm sorry, and then Deborah?
Yes, Debbie Elsner with Beehive Homes.
And then I know I've missed some people. I'm not getting any names popped up, so if I missed you, if you could apologize again. If you could introduce yourself.
Yeah, this is Michael Budd with United Way Greater Lafayette. Good morning, everyone.
And I'm Lori Ernst with Tippecanoe County Council on Aging.
Brooke Stryker, I'm one of the social workers with Franciscan Home Health and Hospice.
Okay, I think that's everybody. Again, thank you for joining us today, this morning. Kind of next item on the agenda is a brief status report of the plan, but first I'd like to just step back. Many of you may know or hear that the Area Plan Commission, that we focus a lot on transportation strategies for vehicles and trucks, when we put together long and short range transportation plans, when we do crash analysis, traffic counts. But we also do another transportation, look at aspects of another group of persons, actually 3 groups, and that would be those who are elderly, those with a disability or those with low income. And back in 2008, we adopted a plan that was what we called the Coordinated Human Services Transportation or Transit Plan. And we looked at the issues, the challenges, the barriers, the gaps these three groups face. And then we also put our heads together and develop strategies to address all these transportation challenges and issues. We updated the report in 2015, and 5 years has now passed, so we are updating that report again. And again, very critical part of transportation is looking at these three groups because they have special needs and issues and challenges that they face. And what we would like to do, again, as we've done in the previous two meetings, is identify those barriers, gaps, challenges, and then develop strategies so that we can address them and hopefully reduce the barriers and gaps. Previous meetings, of course, it was where we all got together and then we were able to have a really great discussion. And unfortunately, with the times what they are now, we're trying with the go-to meeting. So I hope we still do have the good discussion and able to connect people with different needs and challenges, and that others may be able to help or assist as well. So basically today, going to give you a update of the report. We started earlier this year and we put together a list of transportation providers within Tippecanoe County, and that was very successful. We did receive feedback for ones that we did miss. And then at the same time, we also put a whole host of maps together that identified these groups. For example, disabled population, elderly population, persons with poverty. We also looked at the veteran population, vehicle ownership information, housing information. So those are all available on the APC website. So if you want to look at those maps, you're more welcome to do that. After that, we then conducted a transportation survey, and that went fairly well. We had a very good response or turnout for that. And now putting the responses together, and then the next step after doing that, of course, will be putting a brochure that we normally do. Today, we are going to look at the next aspect is that with these three groups, we want to identify the needs, the challenges, the barriers for those who are elderly, disabled, and with low income. And let me see, I have elderly first, so I'm going to bring up that list. So back in the 2015 report, these are the barriers, gaps, and challenges that were identified. We did also send this out in the letter, and what I like to do is go through and get your help to hear if these are still applicable, if they are not applicable, or if we need to adjust those. And then after we get done basically going through these, if there's any new ones, add them to the list. So this is where we need your help in making sure that we get a good list or identification of what the gaps, barriers, and challenges are. Looking back at the elderly group, the first one identified as need EA. Important to have elderly, low-income group housing closer to the downtown area. Is that still, do we still, everybody think that's applicable? Or should we leave that out, or is there any changes? Maybe not only to the downtown area, but to the near downtown area. So if I could get some feedback from that.
I definitely think that's still a need.
Doug, I actually was wondering about the group housing. Like, I absolutely think we need additional senior housing for low income folks, but I wasn't sure about the group housing, what that really was asking. I wasn't clear on that.
Okay. For example, like the in downtown, we have the Fowler House.
So it's not group housing because that's share individual apartments for seniors. So
That would be one aspect of it, but actually group housing, if we had, actual homes where, these people can actually individual homes as well. So we're kind of trying to catch both of them.
okay.
Does that clarify that?
That helps, yes. And I would just say anytime you can get additional housing for low-income seniors, that is absolutely a priority. There's way too many folks that are experiencing homelessness that fit that criteria.
Mm-hmm.
I agree with that too.
I would as well.
So maybe you should take out just group housing and take out the word group and just say housing closer to the downtown area. Would that be more applicable?
Probably.
Doug, maybe the term that would help there is just call it affordable.
Okay.
Yeah.
The low income also has a connotation of other things too, and I think just affordable senior housing downtown is great.
Okay. 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 So that looks pretty good then. Okay, the next one is
I think Adam was saying take low income out, weren't you, Adam?
Yeah, I think just elderly affordable housing. Yeah.
got it. Okay. Thank you for that clarification. Going on to the next one, transportation is usually during the day, limited city bus service, especially at nights and weekends and late evening and morning, and more weekend transportation.
Absolutely.
Yeah.
Okay.
So if I can step in here real quick,
Sure,
Doug,
Bryce.
I did want to say we did add service for 2 routes on Sundays, and we have plans for expansion in the spring of 2022 for our core routes for late night Saturday service. Does anyone have any particular areas that they feel services where we need more services where it isn't right now, especially for evenings and weekends? Any direction you guys can provide is helpful.
I think the feedback that we tend to get, it's not so much for the elderly, but it's just for workers in general to be able to get to late shifts. So that's around major employers.
Yeah, that's what I was going to say. Making sure the buses go after whatever time second shifts ends. Because I think second shifts oftentimes end at 11 or 11:30. And
Okay.
and I don't know what your current end time is, so maybe you've already adjusted to that, but
Yeah, during weekdays it's 12:40 on our core routes, which is the routes that serve the 5 busiest routes. So weekends is much earlier than that. But yeah, I'll take some notes here and we can see what we can do on our end.
And as far as elderly goes, since we're really on that topic right now, they're not going to be using late evening bus transportation typically. They're not gonna go out when it's dark. They're mainly going out for doctor appointments, grocery shopping, that kind of thing, getting around to services, and that is typically going to happen during the week, and it's typically going to happen during the day. So my concern wouldn't be so much the late evening and the weekend transportation. I think for them would be more of a shopping need or to be able to get around to friends and activities.
Okay. Looking ahead, I'm looking at the low income, and we do have the comment second and third shift workers, city bus hours of operation. So I think that addresses the comments for major employers for that service. But looking at for the elderly, so if we just, transportation is usually during the day, limited bus service. Should we just take out the nights then and then just leave in weekend transportation?
Yeah, that would be better.
Okay. Let me see. Trying to do this on the fly, so.
Doug, if you want, this is Sally. If you want to record this so that you can go back and do that, there is a way to record if you aren't already.
Okay. So I can do that, or can you do that?
I'll look and see. Maybe you have to, but I'll see if I can.
Okay, that would be great if you could do that. Okay, so, oh, okay, I was just told we're streaming on YouTube so we can watch this and go back at any time. Looking at the next one, so just following up, transportation is usually during the day, limited city bus, or more city bus service for the weekend. So more city bus service for weekend transportation. Would that then clarify that?
Yes, that would be more accurate.
Okay, great. The next one, the Indiana Bureau of Motor Vehicles, do they have resources for drivers who lose their license due to age? Is that an issue? I'm not there yet, so I don't know.
They generally, it's not due to age. It's more of physical restrictions. So I don't know if if we're giving proper verbiage, it would be.
This conference will now be recorded.
Okay, so due to age and physical ability?
Yes, or yes, physical restrictions or aging concerns. Normally due to size or being whether or not they're able to. It's primarily sight is what we're finding here anyway.
Okay. So should I put sight specifically, or just then leave it as physical ability?
I would say physical ability.
Okay. Going on the next one, sufficient transportation for growing number of seniors. That was kind of like an open-ended one, but I suppose that's probably still an issue.
Yes, definitely.
Agree.
Okay. Going on to the next one, transportation services for seniors with limited income.
Yes.
Okay. Limited service available to public events such as community health fair, free movies, senior bingo and shopping, to participate and or volunteer.
I mean, I would think that would depend on where the event was at, but I would probably agree that basically services are difficult for seniors to access.
Okay. And somebody else chimed in there, get their comment. Okay, going on to the next one, the limited number of drivers and vehicles affects how quickly service can be provided, and sometimes there are long waits for service.
Yes, definitely.
Okay. Bus stop access and getting to bus stops.
Yes.
Poor understanding of the bus system, routes, time, drop-offs, proximity.
Yes.
Market travel training program through agencies that serve the elderly.
Yes.
Access to large medical facilities that provide regional service to seniors.
Yes.
More transportation options in the county or rural areas.
Yes.
Okay, transportation accessibility to pockets of senior housing, such as Wabash Avenue.
Yes.
Yeah, and it would be, I think this probably again would help Bryce if he would get more information on these pockets and where they're located. Would that be helpful, Bryce?
Yeah, and on that note too, for EM, we actually are planning to launch a fixed route hourly service to Wabash Avenue and Community Corrections in the spring of 2021. So hopefully
Hey,
we
that's
can
great
address that.
news.
Yeah. Wonderful.
Yes, we're pretty excited about it.
So if there's any other pockets where they know that of senior housing, if you could just forward that on to Bryce for their future planning, that'd be very helpful.
Yes,
And then
thank you.
also let us know too where we can actually include it in this report. And then of course the next one, cost to providers and individuals.
Yes.
And then the last one that's on the list, the knowledge of availability, the limited number of drivers and vehicles affects how quickly service can be provided. And sometimes there are long waits for service.
I think that's kind of redundant. We had that on EG.
Yeah. Okay. Well, we'll go ahead and pull that then out if that's okay. And then the next question is that is there any additional ones we should add? I know there probably are, but what has everybody seen as terms of issues, challenges, and barriers for the elderly?
I guess the challenge that we're seeing at Caregiver Companion are those who need assistance from the door to door versus bus stop to location. And that's where we get the calls for a great number of needs. Need to make sure mom gets in the door okay.
Versus those who need assistance from door to door versus curb to curb?
You got it. That's it.
Okay.
Yeah, I would definitely agree with that. We see that so many times, and you know, a lot of our seniors are have mobility issues, so they have walkers, canes, wheelchairs, and they're not going to be able to navigate going to the bus stop on their own. So those with mobility issues, that's definitely an issue, and it's, of course, it goes beyond mobility issues, but there's also, you know, cognitive issues and dementia and things like that, where even though we could do a training program and say, okay, great, you're trained, you know how to ride the bus now, they're going to have memory issues and not remember how to do that in a couple of days. So, you know, what we find is we have to encourage the use of these services that are door to door, and they're very expensive to access.
Okay.
This is Sally. I have a question about that. Does that mean that there are limited options for that door-to-door service? Or does that mean that there's nobody, or that part of that service does not include assistance getting from the door to the vehicle and in the vehicle?
Well, there are service providers available, and they're private companies, but there are some like Spirit EMS and some other companies that do provide that door-to-door service. They will stop and they will get out and come get the individual, but it's very expensive to access. And the ones that I'm aware of, maybe like Access Bus or City Bus, you know, those drivers are not able to just hop out and go up to the door. They can't do that. They have passengers on board. So that leaves a gap in service for people that need that.
So it's sort of multi-phased. It's not just the service and its cost, it's actual assistance from the door to the vehicle.
And having more providers that would be able to do that. Definitely. Now, there are some of the services will bill Medicaid for the medical rides. So, if it is a doctor visit or you have to go get labs done or something, that sometimes is covered. But the big gap is, okay, I need to go to the grocery store or I need to go to the drugstore and get my prescription. And then it's very costly for the individual to get that door-to-door service.
And just to say, that's what caregivers does. We are an agency that does not charge seniors to do that exact service. So just wanted to let you know that we're here. Our challenges right now, of course, is the COVID restrictions, but that is something that Caregiver Companion does when we're in full services. The challenge is to meet the need. The need, as you know, is great.
And likely growing.
Yes, and likely growing, that's right.
Okay, as I've been able to see, I've been typing away. Those who need assistance from door to door versus curb to curb. Difficult for seniors who have mobility issues and cannot get to the curb. The service that does provide this is very expensive. There's a need, and it will be growing. And then I also then have small number of providers who provide door-to-door service. Does that seem like it summarizes this conversation as the needs
I
barriers?
think there's one more aspect, Doug, and that's that it's easier and less expensive. This service is easier to find and less expensive for medical appointments, but for necessary shopping and other purposes, Medicare or Medicaid, either one can't be billed, and so that's part of what makes it so expensive.
Yeah, I agree with that.
Does anybody have a complete list of providers for this particular service in our area?
I do. I don't have it right now at my fingertips, but we have one that we print out for our seniors here. So I do have a list.
Yeah, would you be willing to send that to Doug? I think that'd be good for us to have as a part of this document.
Sure.
Appreciate that. Thank you.
Yeah, can we get that sent to Franciscan Home Health and Hospice as well?
If you could type in your email into the chat box, can we do that on this?
Should be able to.
Then
I'm
I
over
can.
the phone.
Oh, okay.
Oh.
If there's a number I could call and just request it and then give you my email.
Sure, that'd be fine.
For anybody who's interested, the chat box symbol is the little circle with a sort of an arrow next to the people icon. So you click on that and you can type in what you want to tell everybody.
Okay, so I have right now, just kind of put this together. Door-to-door service is easier to get and less expensive for medical appointments, but trips for shopping cannot be charged to Medicare, and these trips are expensive. So that's kind of summarize it?
That's correct.
Okay, great. Are there any additional ones we should add to this list? Okay, well, I'm going to go ahead and save this, and then we'll go on to our next list. Let me pull it over. So we'll be looking at disability. So let me expand it out. And thank you for helping us actually get through that one. This is a little bit longer. The first one on the list, some persons with disabilities can use regular buses when weather is good, but can't when weather is treacherous. I assume this is probably still applicable.
So Doug, for people who aren't aware in this group, City Bus will, and I don't know if this is applicable to only City Bus, but we'll provide what's called conditional eligibility. So, during inclement weather and things like that, if a rider who normally rides the fixed routes is unable to do that, they can use the access service for certain circumstances.
That's great. That's something I didn't know.
Yes, that is. So I didn't hear any feedback from that one, so we'll leave that. The next one is developmentally disabled special needs are not always able to master bus schedules.
I would say definitely, and definitely with some mental health conditions that with anxiety, a lot of people have anxiety of riding the bus as well.
Mm-hmm. 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 Doug, I think it probably would be useful to add, at least I don't typically think of anxiety as a disability, and maybe it isn't really considered a disability, but anxiety should probably be part of that statement.
Okay. Disabled. Nope, my fingers can't type.
Well, instead of calling out anxiety, can we say something about just mental health needs? Or, I mean, I feel like we're just pigeonholing if we just say anxiety. There's lots of health disorders.
Absolutely.
Yeah, yeah, it's not just anxiety. There's all kinds of mental health needs that doesn't really fall into developmental or maybe even special needs. So,
yeah, any way you can help us appropriately and inclusively phrase these issues is tremendously helpful to us.
how about saying mental health needs?
Okay, so I have, should I take out the developmentally and just say disabled, special, and mental health needs, or persons who are disabled, special, and mental health needs are not always able to master bus schedules?
I think we're looking at 3 different categories. And I'm not on the developmental side, I'm on the mental health side. So I don't know if there's a difference between developmental and special needs, or if that can fall into one category, or just saying persons of
you could say disabling conditions and mental health needs.
There you go.
The only thing I would say, though, perhaps your solution to those challenges are different. If you have someone with a developmental disability, a cognitive, probably better to say a cognitive challenge, that's going to be different than someone who has a physical challenge. They're in a wheelchair or something, you know. So,
but don't you think, Michael,
this is the schedule one, isn't it? So that would be cognitive. The physical challenge wouldn't have a problem with the master schedule. Sorry, I was thinking about the one before.
So persons who have physical or or.
Well, no, actually, I would take out the physical. I was thinking about the one before. This one's about master bus schedules. It would be cognitive challenges would be the bus schedules.
So take out mental health needs and then put cognitive needs.
No, I'm not saying take out the mental. I'm talking about on the people with we're talking about people with disabilities and special needs if they're different.
Mm-hmm.
I think that the disabilities is for bus schedules would be a cognitive disability, whereas special needs, and I'm not sure. I mean, I'm not sure what you're referring to there. Typically, special needs is referring to people who have physical or cognitive disabilities. So
I think we used the word special as just like a catch-all to try to be more inclusive last time. But
well, that would get you there.
yeah. So persons who have cognitive disabilities and or mental health needs, take out the special. Would that
Yeah, I
work?
think that's fine.
So persons who have cognitive disabilities and or mental health needs are not always able to master bus schedules. How's that?
Yeah, that's better.
Okay, great, thanks. The next one, lack of travel options for persons who are disabled, especially those with seizures. I don't recall the specific discussion we had the last time for this one.
I'm not sure what that means.
I think if I'm trying to remember back the last time, I think somebody reported the last when we did this that they were transporting persons who had seizures, but they didn't really have the good resources, so that if somebody did have a seizure while they were traveling, nobody to take care of that person, just not the training, and that I'm not too sure if this was correct or not, but if there was transportation being provided, and if the person did have seizures or noted that condition, then the provider would not transport them. When I don't remember the specific discussion regarding this, but
Have any of you come across this issue for your clients? Or, and I guess that would include city bus too, because your drivers might have faced this.
Yeah, we do rarely have people who've had seizures on the bus or on property, and we'll typically just call 911 or emergency services. We don't have training to really appropriately address that.
so then probably we should take this one out then. Is that my understanding?
I don't know where others would land on this, but it seems like it doesn't city bus. You have. I mean, if someone were to have a heart attack on the bus, would the drivers know, to lie them down and prop their feet up, or would they not know that? I mean, because that to me, that would be where seizures would fall. Is if somebody were having a seizure on the bus, is the staff trained to know, get them where they can't hurt themselves and then call 911? I mean, that would be to me, that would be it'd be like another medical challenge.
Sure. So for us, we don't do any training like that. We actually instruct our operators not to act as first responders because we don't want them to do more harm than good. So their primary responsibility, if there's a medical emergency on board, is to contact 911 and make sure everyone else in the bus remains safe and out of harm's way.
So maybe a possibility is to reword this for additional medical emergency training for drivers or providers, instead of having specifically state seizures, just leave it more open for training for medical emergencies.
Well, I'm not sure that city buses even wants to do it if it's available.
Right.
I mean, to me, that's a provider policy decision. And operations. Now, that might be a solution, but that's not, these are issues, right, Doug?
Correct.
So I think the issue might still be valid, which is that there are fewer or a lack of travel options for whatever, for the group. But it seems to me that whether a solution works or not is dependent on the policies of the transportation provider.
Okay.
There may just be too much liability to get into the medical aspect of that.
Right. Should I just then go ahead and remove this one from the list?
Well, it seems like, and I don't know what others are thinking, but it seems like your need is immediate stabilization procedures for certain health incidences, especially related to seizures. I mean, the seizures are still, I mean, if somebody has a seizure on one of your buses, you could very easily keep them from hurting themselves or others. And if you just let them do what they do, then you could very easily have them do something, hit their head, bang, there's lots of, when it goes into a seizure. So I don't know those things, but it does seem like that's a potential risk for individuals with disabilities traveling, that there isn't someone on the bus or whatever transporter. There isn't a way to have someone able to stabilize them until or not stabilize, that's the word, able to keep them safe until first responders arrive.
Right.
If I was prone to seizures, I would not ride the bus, knowing what I know now.
So is there I guess, do you think people are turned away because of a disability, or because we're looking at here lack of travel options for persons who have or who are disabled? So I know there are a number of different providers that do provide services for persons who are disabled, but is there a lack of travel options for persons who have a disability?
Why don't we just say limited travel options? Because there are travel options, they may just not be the best.
And then take out, especially with those with seizures.
I would say including those including those prone to seizures.
Now, based on the quiet from the rest of the group, I don't think we have probably someone from Wabash Center or not sure what other organizations might be able to provide greater insight to that question.
Well, are there any other categories of persons that are disabled that don't ride city bus? I'm thinking of one veteran that I work with. It's not city buses is concerned, but he needs travel to a veterans hospital, and he's not able to ride the veterans shuttle because of his oxygen tank. And I don't know if there are similar types of things that, because of the devices that people need to use, that they're just not a good fit for public transportation.
That's astonishing that the veterans home can't accommodate that.
Well, it wouldn't be the veterans home itself. It was the veteran services folks, and that decision was made, and they were told that years ago. At this point, And so we've never gone back and revisited just because of hard feelings. But but I don't know if there are categories like that where persons, because of whatever their medical situation is, just are told not to ride.
I don't see that actually on our list, so that sounds to me like it probably would be a new one.
Well, I would, before I put that on that list, I'd want to circle back just to make sure that's still the case. But it was the case as of, I guess, 3 years ago. That's when we first started giving them rides.
So it
that's
would
something.
be certain medical issues that either limit or limit travel options.
Yeah, and the theory apparently is that that oxygen tank is highly flammable.
Oh.
So if I add including those who are prone to seizures and or have certain medical issues, would that cover that?
Perhaps. I don't know if City Bus has a thought on that. Are there certain categories that they find can't safely take the bus?
We do have certain guidelines. I'm not sure of the specifics on that, but I'm not aware of us turning anyone away because of oxygen tanks or anything like that.
Mm-hmm.
Doug, that in your addition, I would just make that or.
Okay. 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 Thanks for clarifying that and working on that. The next one is difficult for blind, low vision passengers to use city bus. Does that seem to be an issue still or not?
Is that fixed route or access?
Well, we didn't say either, so I would assume with this it would be probably either.
I would say yes. I would say yes. We just had an individual come into my office that is partially blind, that had difficulty riding the bus.
That was the fixed route.
I don't know that.
Okay. Okay.
Do you have any idea from your conversation what the specific issues were for them?
It seems like it was getting to the bus stop, and I don't know where she was located at.
So yeah, it's not. I think if to make it clear that it's not a problem once they're on the bus, it's a problem getting to the bus, which is the sidewalk and other accessibility issues to the bus stop, right?
Yeah, I didn't have a full conversation about her difficulties with the bus.
Okay.
So I can't say for sure.
Well, and it does seem, and I have limited experience in this space, but it does seem like, if a bus stop opens out to a handicap accessible pad, then someone who's visually disabled is fine. But some of the bus stops probably drop off to grassy areas, uneven sidewalk, those kind of things. So to me, that seems like that would be the issue more than, as being said, than being on the bus.
I think that's an important distinction to make.
I mean, once a person's on the bus, that's a pretty predictable space.
Right.
Mm-hmm.
It seems like those that are blind, it's the unpredictable space that's a challenge.
Right.
Okay. So for difficult for blind, low vision passengers getting to a city bus stop and at the bus stop, would that catch both of them? Or
and inadequate facilities at the bus stop or unsafe facilities at the bus stop. I would say maybe unsafe.
Okay.
I can think of a circumstance with a young person who called us, and this is something that is not what you can manage, but just to let you know, that as far as I know anyway, but she called us because she is blind, and she had stated that she felt unsafe because she would be what she called hit on or asked for her information from another passenger on the bus. So she was not wanting to use the bus because of that circumstance as a young lady. So that's, neither here nor there, but as a blind person, of course, they already feel so vulnerable. So just wanted to make that comment. And she said it happened not repeatedly, but enough times that she didn't want to be on the bus anymore.
So a safety issue actually riding the bus then be kind of like.
For this particular lady, yes, she was challenged by feeling like she was unsafe with some of the passengers.
Getting to a bus stop, unsafe conditions at the bus stop, and then riding the bus. Should I throw that in or put as a separate one?
I guess that's where I'm not sure, but I just wanted to, let you know that was something with someone coming our way who was a young person.
Yeah, I just recently heard I think it was an NPR story about that very topic. They were talking about how blind in general are touched throughout the day and kind of that. And so I don't know that that's it's an impact on someone's probably desire to ride a bus if that is one of those spaces, but I suspect that's every space. Unfortunately, it's kind of a sad story, but and just the ways that people help them cross the street and all the different ways they uninvited in touch or help, air quotes.
Doug, I would make that a separate one.
Okay.
It's to me, it's a sort of an attitude, a public attitude problem, as opposed to a facility problem.
Yeah, it's a general approach towards people who are blind versus something any of the providers, city bus or others are doing, right? I think that's what you're.
I would say.
So leave it more open to include more transportation options rather than just the bus.
Well, I guess to me, it sort of is that inappropriate assistance to the blind and low vision create safety and security concerns. Is that an appropriate summation, or is there a better way to say that?
I think overall that's fine. I think it covers the bigger picture of how she felt and the vulnerability that they have, that they experience.
Okay, so what I wrote, inappropriate
creates.
Who creates? Okay.
Not know who.
Okay. So does that seem like it catch the discussion?
Yeah, and I think maybe what we can do is add an example, and that will help us recall this discussion. So an example like we can craft something, Doug, but it's
Okay.
the physical touching
Okay.
while crossing a street for is an example. You know, by somebody who considers themselves a good Samaritan, when in fact it's not a good idea.
Okay. I have some wording there. We can wordsmith that and come up and do that after we're done with this. So, okay, great. Great discussion. Next one, some developmentally disabled group homes are outside of city bus routes or outside of city bus routes. Does that seem to be still an issue, challenge?
I'd like to add to that and say, be more inclusive as service providers and supports, and just not limit it to group homes.
Disabled service providers
And
supports.
Service and support providers. And then we could maybe say including group homes.
Okay, does that catch it? Did I get it right?
Not necessarily developmentally disabled service and support providers, but I'm talking mental health and substance use providers.
So just drop developmentally, just some disabled service and support providers.
Well, we could probably go back and use the language that we crafted for the first set of issues. Where we have mental health and some other things.
What Sherry's saying is that group homes for those with developmental delay disabilities is one, but also we have group homes for folks with mental health and substance use challenges that are also going to fall outside. Those will also be people who aren't able to provide their own transportation, right? Right, Sherry, that's what you're saying.
Well, not necessarily group homes, but I'm talking about services. So like Meridian's ARC program out at Riverbend, like Limestone.
Oh yeah, I got you.
Places like that people can't get to on the bus. So it's not just developmental issues, it's also mental health or providers. It's also mental health and substance use providers.
So maybe this is a separate one. Maybe the first one is your group homes are outside, but then you have key service providers for a multitude of health and human services challenges that fall outside of the city bus range. And in that case, mental health and substance use disorder services would be one example or two examples.
So do these providers, how do they get in a situation where they are beyond their clients' ability to access them?
Well, I don't know that I can necessarily speak for Meridian, but to get into Meridian, there's usually the family transportation that takes them out there. But to go on to ongoing services out there that not necessarily residential, or not residential, but inpatient, it's difficult to have a program out there for people to get to.
But why are they there providing that service? Shouldn't they be in a more accessible location? I mean, I guess I'm having trouble finding out how that decision got made.
You know, sometimes the service that they're providing, though, is mainly to just the general population, but a portion of it is to the low-income population. And I'm thinking of, I think it is Limestone that's out by, or out kind of in a corner, or some of the far reaches, you kind of have to do that just because of the service that you're providing, or that's kind of where the medical zoning is. There just seems that there's a bit that goes into it, but it's not because they're 100% low income clientele.
Well, and you also, I mean, frankly, you have a limited opportunities for locations, and so there are many factors that go into the selection, and being on a bus route is always something that comes up if possible, but it just isn't always possible.
Yeah. Okay. I just think that there have been a lot of medical decisions made, well, medical and employment decisions made that didn't take into account their clients' transportation needs, or sometimes their staff. And it was a major gripe of mine when IU Arnett decided they wanted to go out by the interstate where there was no public transportation. Clients couldn't get there, staff couldn't get there unless they were of an economic situation where they had their own car. So I have had a long-standing concern about some of the big health and service providers and some state agencies, for that matter, making really what I would consider crummy locational decisions.
And I would second that, Sally. I think when you put it that way, many of us are in full agreement with that.
Yeah, in a case, and I agree as well. I think in the case of, like, for many times for nonprofits providing service, they're not in the ability to build a space. So like in Limestone's case, that was, I forget what that, it was an empty building, and it was, and as Adam said, it was close to the freeway, which made sense for probably 80% of the people they serve, but it doesn't make sense from a transportation standpoint for the population we're talking about in this call. So,
and I agree, it's a huge challenge for not-for-profits to be able to find appropriate space at an appropriate location for an appropriate cost.
Right, and actually, Limestone's not for profit, but it kind of falls that same category because of the work they're doing.
Yeah.
So basically, I think I broke it down into two things. One kind of mirrors what initially it was. Some developmentally disabled persons, including group homes, are outside of the city bus routes, and then kind of mirror that. Some key services and service and support providers are located outside the city bus route. So we have the person, and then if they're in the home, a group home, and then the services and support providers. Does that kind of summarize this discussion?
Yeah, in your original one, it says some developmental disabled group homes, not persons.
Okay. Disabled group homes.
Yeah.
Like that?
Yeah.
Okay, got it.
It's probably would be better if it's some group homes for the developmentally disabled.
Yes, that is a more appropriate way to word it.
Would anyone have examples other than Riverbend Hospital of group homes or other services that are currently not served by our fixed routes? I'm taking notes here so we can make sure we address some of these things.
I need to leave the meeting. Can I get the phone number of who I need to call so I can get that list of local transportation providers?
A complete list of all providers?
Yeah,
no,
for like the Medicaid providers and
okay.
just, yeah.
Well, once we get it, we can just call our office, 423-9242, and Doug can send it to you.
You said 423-9242?
Correct.
Okay, thank you very much, and appreciate everything you guys are doing.
Thanks for joining us.
Yes, thank you for joining us. Okay, so I have it broken out into two. So are we good with that and ready to go on to the next one?
Yeah, unless somebody has a response to my earlier question about underserved or unserved locations.
Sherry, does that get to what you were wanting?
Yeah, of course, you know, we have the transportation committee from the resilience and recovery network. So this is where it's coming from, and I know there's other places out there. I just don't have them right off the top of my head, but I could work on that and get that to you, Bryce.
Yeah, it's someone. I'm sure there are more.
Okay, so great, we'll get that taken care of. Then going on, the next one, agencies are seeing more clients who are disabled from war injuries. This is a trend that we've been seeing actually in our census information, that we keep seeing this group grow. Does that seem to be still an issue? Okay, we'll leave that in for now. And the next one is specifically for Wabash Center. Since we don't have anybody from Wabash Center, apparently, I'll go ahead and reach out to them and then follow up with that one. And then the next one, work release persons need transportation to and from the community correction facility. For me personally, I know that's been an issue, and I think Bryce mentioned that some good news on that earlier, if I remember correctly. Is that right, Bryce?
You did remember correctly, yes. We're looking at putting in a fixed route service for community corrections in Wabash Avenue in May of this upcoming year.
Okay, so without that, we'd still have an issue. So how about if we just leave that in for this time? And it's great to hear that that will be served in the near future. Is that okay?
Yeah, I'd suggest we leave it in, and then in sort of the solutions section, we'll put in the status of City Buses project, and also that the county's working on, well, the county and the city are working, hopefully we'll be working jointly to provide a trail connection up to a community corrections building.
Mm-hmm. Okay, great.
Doug, Jennifer,
yeah.
Hold on, before we move on. So
okay.
I just was wondering, why do we have Wabash Center's numbers in here? Like, are they the only agency in our community that serves people that are disabled? Is that why? Or like, should we get all of the numbers from all of the agencies that serve folks that are disabled? Like, I just feel like that's really out of place, like what the need is. Like, I don't understand that one.
I think that came out of our discussion at the last time that we updated this report, in that the person who is representing Wabash Center felt that there was a need, a challenge, because they had such a large clientele. And it seems like they felt, from what I recall, stretched to actually provide all the services.
Okay, so every one of the agencies that are stretched from the supply and demand we have right now, like, do we all need to list all of those and all the needs for transportation? I feel like that doesn't make sense to even be on that. So
okay,
I would agree. I don't think we should list numbers for one agency and not others. So in the disabled category or mental health category, I think we could say that numerous, or if you think it's not a stretch, all local agencies have underserved clients. Is that fair?
I absolutely think that's fair. Yes.
Okay.
I agree.
Okay. Okay. So I made that change. Is that okay? Then after the community correction one, most transportation is during daytime and limited city bus service, especially night and weekends. Does that seem like one we should keep as a challenge, a barrier, a gap with this group?
I think what Doug, what hurts recommendations like DI and even DG, frankly, is we're not really sharpening the pencil on what the need is. We're just saying in general. And I think what might be helpful, and if this isn't the time to do it, that's fine. But you know, how late are we talking? You know, where are we talking? When we say that social service agencies, their clients are underserved, you know, saying that is fine, I think, but it's not. It doesn't really get us anywhere. It doesn't move the needle any. And so I guess I'm just kind of saying, if we could find a way to be a lot more specific, that might strengthen those description of needs.
I agree. I think that's a fair point.
Yes, and that's where we would need information in terms from like this group discussion is what can we specifically put in to actually be more descriptive.
So I guess the sentence would start out with clients need public transportation or private need transportation until, I don't know, 11 o'clock at night or midnight or whatever hour is appropriate, for the purposes of, and then list some very specific things.
I would think on DI in particular, you know, shopping, if there's any kind of work need there with the disabled population. I know that's covered in the low income one, and typically those go hand in hand, but not always. I can't think of though other things night and weekends that go beyond what City Bus does, other than shopping and work.
Would there be, you know, obviously we haven't done this for about a year, but would there be things like entertainment?
You know, when you say that, Sally, I get wistful because I think there's still entertainment in the pandemic, but I know that this report isn't just about right now.
Yeah, I would agree with that sentiment too. I think, you know, weekend events, cultural events are difficult for a lot of people if they're using fixed route transit services, because most of our routes are ending at about 6 or 7 o'clock at night on Saturday.
Yeah, community and cultural events probably are a big deal. We do have a lot of evening community events here.
Yeah, I know some communities that I've lived in have done special bus transportation for those kind of events. Have we done that here locally? I don't know if the city bus, you know, added routes for certain events or anything.
I believe we've done it in the past and it just wasn't particularly successful. So it's something we can revisit, and I'll make a note of that too. I think it's a great idea.
Well, that's the challenge for you all, and I think to acknowledge this. You know, we can say, well, we need a city bus route that runs till 12:30 to hit the all the second shift people, but all those people are making decisions and they may not want to ride the bus, even though it's going there. They may still, they may still find a ride. So then you don't have a very very cost efficient route.
Mm-hmm. Mm-hmm. Mm-hmm.
Well, and then there's always the employers who could step up to some extent.
Yeah, we've asked them, times they've been asked to consider, and actually at least one does, Kirby Risk changed one of their shifts to accommodate bus riders.
Good.
I think they start later, and I don't know, they adjusted the shift, and they call it, at least they used to. It's been a few months since I talked about it, but they call it like the bus shift or something like that.
Mm-hmm. Yeah, I know their day shift starts at 5:15 in the morning. Because my older son works there.
Yeah, so they had another shift that would start, and I forget how early the bus can be there. May have been seven, maybe I can't remember. But but they had the same challenge, was that, and I think City Bus you may even go into their parking lot.
Yes.
Do you have enough people to ride it, right? So it's kind of, you solve the problem, but then you have consumer decisions as well.
And this may be a better time to talk about it in the low income area, but since we are talking about it, SIA still has the Wheels to Work shuttle that Pastor Kim Dickens operates, and they've been doing that for over 5 years now, and more than that, but they are grossly underfunded, and they're really the only resource for SIA, especially for the cleaning crews and the ones that, they're not making a ton of money, and it tends to take more entry-level folks out there. And it'd be great if SIA and others stepped up, but we know that even the shuttle that's trying to cobble something together, they are running on a razor's edge and financially to do that.
Mm-hmm.
And so I think in addition to the idea of making a list of social service agencies that need better access, that would also be fruitful, I think, to look at employer sites that need better access, because all of them have cleaning crews, even if they make the argument that we pay too much for people that really need the bus.
No, good point.
Yeah, agreed. Do you know if industry typically here hires, are they employees of SIA or Alcoa or whoever, or do they hire a company?
It tends to be temp agencies. And what's interesting is that SIA, they tend to take from CTI, and CTI is actually outside the bus line too. It's all very interesting. But in the end, those industries are struggling for workers, and so it's a bit of a head scratcher that they haven't really come to the transportation table. But that is where we're at.
Mm-hmm.
Okay.
Mm-hmm.
That is a head scratcher.
Mm-hmm.
I don't know how far you go out on the west side too, but there's growing job opportunities, Research Park and out that way. I'm not sure how far City Bus goes on that side, but you may have it on that edge too.
We do operate fixed route service through the Research Park, but I totally can echo that sentiment about the need for transportation for the manufacturers. We've had lots of conversations with them in the past, so they recognize the need. I think it's really just a matter of funding and who's going to pony up for it.
Have they talked about what they thought the potential ridership would be for those types of routes?
No, the last conversation we had, I think they're investigating some rideshare programs. We don't really think that fixed route service is going to work for them. It will require us to operate service much earlier in the morning and much later in the evening, and it's just not really feasible. So yeah, a van share or a similar program like that would be most successful, most likely. So that's where we left things with them. They were looking into that with a program with Enterprise where they could lease the vehicles.
If you don't mind me asking, how long ago was that conversation?
It feels like a year ago, but it could have been, more recent than that.
Well, and I imagine, which is the way this year has gone, if there was something in the works that was more difficult, is there a point person on that discussion?
Yeah, I can look back through my notes and see who I can find. I can do that for you.
I'd appreciate that. This is Adam with the City of Lafayette. I'd love to connect with you on that.
Okay, and on that note too, I'm going to drop my email address in the chat. So if people have questions or want to follow up with me on anything later, you can do that.
Perfect. Thank you.
Well, actually, I'm working on putting a note in our low income list, but getting back to this list, so keep on track. For this one here, clients need transportation until, and then we need to pick some time for the purposes of, and then just say shopping, work, entertainment, community, and cultural events. Does that seem like that fits?
That seems like what we were talking about. I don't know what that time is, so.
Yeah, I don't know either. Should we leave it, just say, well, it's again, one to maybe try to specific pin it down, but I think it's going to be difficult.
I'm wondering if we can look at other communities similar to ours and see what their transportation schedules run on. Is it a midnight? They probably experienced, less traveled times and have adjusted their schedules, just as an idea to figure out what that magical time is.
Yeah, I'm putting a note on here to do that, and then we can fill it in. Okay. So then we should take out the most transportation is during the daytime. Take that one out completely then. A yay or nay?
Well, based on Adam's comments, you've recreated it in a more specific manner, so it's probably.
Okay, we'll go ahead and pull it out. Going on the next one, Medicaid, Medicare does not pay for taxis, transportation. I don't know if that's still the case.
There are some instances that it does pay for transportation. I don't know if it needs to be the word taxi specifically, but Medicaid and Medicare, but primarily Medicaid, will pay for medical appointments, transportation to medical appointments. It's limited, especially Medicare. It's a new program, or you have to be on one of the specific Humana, I think it is, services. So I would say limited. Maybe where it does not pay would have been what it was a few years back. It now would be that it's limited.
Okay. So Medicaid,
transportation. Mm-hmm.
So Medicaid, Medicare only pays for limited transportation services?
Correct.
But
okay.
It's medical only though, right?
Right, medical only. Mm-hmm.
Yeah, limited medical transportation services.
Okay. Okay.
There's also related to this, and I don't think this would have been in place. There are private dollars available for Uber and that type of transportation, but I think it is also limited to medical services. So
okay.
It's kind of the same, yeah, but there's privately funded. Right now, if you call 211, there's a contract with Uber that they'll they can set up appointments. But the funds are limited, and I don't actually know right at the moment if they have any funds available, but I know they re-up the funding every now and again.
Okay, so
Is that Uber funded by the company?
I believe it is privately funded, and Uber maybe provides a discount. The Uber driver who does the driving is getting paid.
Yeah.
I mean, that would be obviously, that'd be a bad model to make them carry it. So, and I believe I can't remember the source, but there's grant dollars that have been provided.
So then add a second one or another one, basically mirroring the first one, saying private funding is limited to medical transportation services.
Yeah.
Okay. Going on the next one, access service time is limited.
Doug, could you put a note with that last one? Just put Uber in parentheses so we know what that was about, and then we can word craft it a little maybe.
Okay. Going on the next one, access service time limited. Does that seem to be an issue still or not, or a challenge?
And that's access as in city bus access
Correct.
service. To the casual reader, I'm not sure that's obvious. Yeah.
Is that duplicating what was talked about before?
Yeah, maybe.
Yeah, access service is complementary to the fixed routes, so it only operates in the locations and times that our fixed routes are operating. So I would say yes, it's a duplication.
Okay, we'll go ahead and remove that then. Going on the next one, concern about van safety. Nonprofit agencies cannot use 15 passenger vans anymore, and 12 passenger vans will probably be prohibited soon.
Did that actually happen?
That I don't know. Can anybody else chime in on this?
I have not ever heard of that. I'm not sure where that came from, but I know several agencies that still operate 15 passenger vans.
I think what it was something around the licensing requirement for driving them.
Whether they had to have a CDL or not?
Yeah, I mean, it seemed like it was, I forget the details. It seemed like it was something like that, but I haven't heard that as a issue at any agencies. So those that are affected, they may have figured it out. I don't know.
Okay.
I also have a vague recollection of something along the lines of safety features in those vans.
Yeah.
But I don't remember specifically. It likely came from Wabash Center, didn't it, Doug?
Yes, and I think there was another agency that chimed in, but I don't remember who it was.
Yeah, a year or two ago, a number of agencies, I think, were having to get rid of certain vans that didn't meet criteria, but I don't remember the criteria. So that may be one. If you leave it, you probably have to track down somebody that operates one of those vans. But I think, as Lori said, I'm not aware of anyone actively having that issue.
Okay, so for this time, we'll just go ahead and remove it. Going on to the next one, lack of sidewalks, crosswalks, and pedestrian amenities in some areas, and then we specifically listed South Street, east of Sagamore Parkway. Yeah, I do have a side note on this one. That's good news, is that we're in the early process of developing a new transportation improvement program. And the Lafayette City engineer, Jeremy, actually submitted a project to actually put sidewalks, trails, and as such along South Street. Fairly expensive project. But that is definitely looks to be on the crosshairs of the city.
Like over $7 million.
So I think for the time being, we're going to leave this one in because I know there's other areas of lack of sidewalks and crosswalks, if that's okay. Going on, there's a misconception that access bus pickups must be on or very close to the regular bus route. Is that still an issue or challenge? Has anybody else heard of that?
Well, to be clear, pickups have to happen within 3/4 of a mile of a fixed route. We won't operate any further out than that.
Okay. So
But
should
I
we
wouldn't
take?
consider that very close, personally.
Okay.
You
So
said you
then,
would consider that very close or wouldn't consider that very close?
I would not. I would say most able-bodied people wouldn't even be willing to walk that far. So I wouldn't expect that of someone with a disability.
Right.
mm-hmm. So should we take this out then or leave it? Or change it?
Well, there's the actuality, and then there's whether there's a misconception.
Mm-hmm.
And this is geared toward, is there a general misconception about what access can do? Or has that been solved because people have talked to their clients about it?
Mm-hmm. Mm-hmm.
Well, it doesn't sound like it's a problem anymore. I take it out.
Okay, we'll go ahead and do that. We only got a few more on this list. A list of potential providers need to be more accessible to potential clients. Actually, I think we had a little bit of discussion of that earlier. Does that still need to be something that we needs to be done as an issue?
I guess the question is, has the pamphlet that Doug put together and kept up to date in English and Spanish resolved that issue, or do we need to promote that more?
Well, and we provide lists. I mean, there's a lot of lists, and you got 2-in-1. There are many ways for providers to provide clients with information. It seems like this is one that the last time you had someone who didn't think they were able to provide potential clients a list. So I don't like, it doesn't seem like something that fits on this plan to me, but but there are a number of ways for providers to have those lists. Now the challenge with any time you have that kind of list, though, is it's wrong the day before you publish it.
Yes. Mm-hmm. Mm-hmm. Mm-hmm.
Like you never can keep them up to date. So.
Mm-hmm. Well, personally, I think I'd like to leave this in because this gives us an opportunity to say that, we're actually putting the list together, and it gives us more emphasis that we need to continue to do it, which I'm actually, in the process of working on an updated one. So I'd like to leave this one in. Going on the next one, need more transportation options in the county or rural area. I've heard that this from several people that this could be this is still a challenge.
Well, so do we have a sense of how the Area 4 rural transportation effort is going, or how well that's meeting the need?
I do not have any information as to the number of trips they provide or how well it's doing. That's something we can look at. But at least it does offer, has the option or the opportunity for people who live in the county to actually, either go to another part of the county or actually, to the either city. So we can
Yeah, and this is an issue also for your low income. you have pockets of places where people live that, not sure how they live there and not have good transportation, but I agree with Adam, though. It's probably a question to Area 4. I know that program, but I haven't heard, other than knowing it exists, I haven't heard if they feel like they're meeting the need or not.
Here too.
So we can follow up on here at APC staff. Okay. Lack of good demographic data prevents good planning and makes designing performance metrics difficult and possible. I know in the past the census data definitely used to be down to the block group and especially block level. Now it's not, and a lot of the data that I used for these maps were basically from the American Community Survey, so that it's, you do have not exact data. I know that's the challenge, putting it together. Is it actually correct or not? But with that data, we were able to actually put a lot of maps together. So I don't know if there's any feeling to leave this in, or should we just go ahead and remove it?
Well, Doug, is there anything we can do about it? Since if the census is changing, I don't, short of a census-like effort, how do we address it? Because I guess what I'm saying is, if there's nothing we can do about it, I don't know what the value of highlighting it.
Yeah, that's exactly right. There's nothing really we can do about it. I mean, basically there is opportunity for comments, but in listening to the comments and reading them, it seems like there's other issues or other persons that do have this issue, but yeah, it seems like every year more and more the information that was available has been removed. So it seems like it's an issue, but it's nothing we can actually do anything about.
Yeah, I think we spent 10 years kvetching about the lack of good data here from the American Community Survey, and until we have more data points, it's going to be crummy. So all we can do is use best available. So I think it's time to take it out.
Okay, I will go ahead and do that. Going on, got 2 more access bus offers 1 round trip per day per person, sometimes more than 1 trip if is necessary. Has there been any change on that, Bryce?
Well, this would be unequal access, and I'm pretty sure a violation of the ADA. So it's not accurate. And you can book as many trips as you want during the day on access, as the schedule allows.
Okay.
I'll talk to him, because we updated it in the way they told us, so it wouldn't have to be updated every year. So
She's got that email. She's on the
Okay, going on to the last one, there's substantial costs for disabled persons in riding the bus. I don't remember where that comment came from, but I think it's the same fare, if not reduced. Is that correct, Bryce?
So this is probably in regards to the access bus. That service is $2 per round trip, or I'm sorry, per one-way trip, which is double the fixed route fare. But we do offer half fare for the fixed routes at 50 cents. And then access certified riders can ride the fixed routes for free. But $2 is still, probably pretty significant for a lot of people. And if you got to take a round trip, that's $4. So I can definitely see that being an issue for people still.
So just go ahead and add access and then leave it
That'll
in.
be my guess. I don't know if anyone else has any feedback.
Is there any other feedback for this one?
I've not heard that to be a problem with people we work with.
Okay, should we go ahead and remove it then?
Well, is anybody getting complaints about the cost? If nobody's getting complaints, then doesn't seem to be an issue.
Okay, we'll go ahead and remove it.
Well, you probably have individuals, you'll have individual cases, but the question is it a systematic issue?
All right.
And I would guess it's probably not.
Okay. And then we have one more list. I'm sorry. Try to get through this quicker. There's fewer on this one, low income. And then second and third shift workers, city bus hours of operations. And this is where we had the discussion earlier, funding for transportation like rideshare to employers. The discussion was city bus, the routes don't lend itself easily for this, but maybe like ride sharing or van service would be better. Is that correct?
Yes.
Okay. Okay. And then I'll go ahead and wordsmith that here and later on. Going on to the next one, lack of affordable transportation for low income, cost, unable to afford bus passes, and cost availability. There's a lot in that one.
Does someone have an insight on what that means by cost availability?
Bus passes, cost availability. I'm trying to remember the discussion on that, and it's very vague, and I know there was a lot of discussion on it, but I don't remember the specifics, unfortunately.
This is Jennifer. I'm back. I'm sorry if I missed some discussion, but I had a meeting that I had to jump to. And I just wanted to talk a little bit about this. I don't really understand what cost availability means, but I will say that for those that are low income and unable to pay for transportation, it's a huge cost share for agencies that try to provide this service. It would be very, very nice if we could have some kind of assistance program where maybe agencies could pay those that are disabled and elderly, they pay for half price for bus passes, or some kind of price reduction based on income, or people that are experiencing homelessness. This is a huge problem for people.
Has this issue ever come up with United Way?
You mean the cost of transportation?
Well, I mean, having a program, United Way is doing so much good work in hands-on solutions these days. And I just wondered if that was something they'd take on as I don't know, like a grant opportunity.
I mean, we would certainly consider it for sure. I mean, transportation comes up, and Jennifer knows this better than I do. Transportation comes up every single time we talk about low income and barriers. Cost is part of it. So we certainly something we could consider.
Yeah, you guys have, in my opinion, have almost turned around 180 with the kinds of direct solutions that you're working on, as opposed to the way United Way used to operate. And I think it's a really good thing for the community, which is why I picked on you for this idea.
I appreciate that. We would, of course, work through our partners. I mean, they're interacting with folks, and it would just be a matter. I think, Jennifer, to your point, would be: is there a way that we could figure out funding to make it so there's at least a reduced price?
Exactly, Michael, because honestly, United Way is paying for it now, whether it's through LTHC or Salvation Army or what other agencies are paying for transportation assistance. So it's a huge cost.
Yeah.
So if we remove the cost of availability, the lack of affordable transportation for low income pretty much basically sums it up, just that first part of it.
And maybe take out cost and leave unable to afford bus pass.
And then just, so it's like that. Oh. So does that cover it?
I think so.
Okay, going on the next one, transportation options for those who look for work. This, I think, goes back to the first one, looking at working like for second and third shifts. So it's almost a similar type comment. So you go ahead and just pull that one out then.
No, I would actually leave that in there. So this is people that are looking for work. So it could be during the day as well. So this is a whole nother funding stream that we use for transportation needs.
Okay. Okay, great. We'll go ahead and leave that in. Limited city bus service, especially at nights and weekends.
Seems like that was duplicated.
Okay.
Well,
and then also,
Doug, I guess the question is, do we want each of these three groups to have their discrete list, in which case there might be duplication?
that's correct. We want to have the three different lists so that we can address each one. So this one is right. It's applicable to the other groups as well. So, because in this one here, we're just specifically focusing on persons who have low income.
Yeah, so then what I would suggest, because on the first one on this list, you have second and third shift workers. So I assume that it touches the work hours. So that's what I would say duplicating. So I guess this one is the limited city bus service, especially nights and weekends. And are you talking about then for shopping, cultural? I mean, all those things you listed on the previous list.
Yeah, good point.
Yes, I think you're right. This is could be first one was just specifically for work, but this one incorporates all other trips as well too. So
yeah, the cultural events, shopping, entertainment.
So we'll just leave this one as it is, and
well,
then
no, Doug, we need to make it like we massaged the ones in the list.
Yeah, because the other list, the issue was more about cultural stuff. The list is work and other activities. So you've got work covered. So.
Okay, I just made a note there to add the wording from the other list. We'll do that. Going on, time constraints for city bus riders.
I'm not sure I know what that means in relation to the prior ones.
I think when this one is like when you if the route it has like it operates just once an hour, that you have to plan your trip and then catch the bus and then go where you want, like for example shopping, and then say for example, well, either I'm limited to the amount of shopping because either I have to catch the bus for this time or the next time, which may shorten or lengthen the time.
So we're talking about frequency of schedule, bus schedule.
I believe that's what this comment was related to.
That makes sense. I think we can word it so it's a little more understandable.
Well, and just as and Adam and Jennifer may have some on this, but if you ride the bus to work and you're 1 minute late, you could get fired.
Right.
If you drive to work and you're 1 minute late from whatever you're probably fine. So that obviously you can't make the bus show up every 5 minutes, but that's a challenge I think people in this category face. Normal play of life, they're running just a minute or two behind, and it can be catastrophic.
Right, or they drop their kids off at daycare and then have to talk to the teacher for a minute and miss the bus that would get them to work on time.
Yeah. I don't know that there's a solution to it other than it's just a reality, but.
Right.
Okay, so I added some information there where we can add maybe additional wording and take care of that after this. The next one, limited hours of availability of public transportation. So this is kind of more general, but
seems to me we've covered it already.
yeah, I would agree. Go ahead and take that one out. And then the next one, more easily available assistance to get on Medicaid. I think the process here was trying to get on it from what I can't remember who made this comment though. Does that seem to be an issue or not?
So others on the call probably should chime in. I should be talking less, but Medicaid has HIP 2.0 has presumptive coverage at hospitals and whatnot. My understanding, the challenge on that system is that if you've gone to the emergency room, they've done presumptive coverage, got you signed up, and you don't pay your premium, even if it's $5, and you can be pushed off for 6 months. So I think it's the complexities of the system, I think, that makes it harder for people than, I don't know, others may have a clearer image of that than I do, but.
Well, Michael, this is Jennifer. So I guess I feel like, before COVID, they actually had providers that would come on site to enroll people into insurance programs. So I'm just not so sure that this is really applicable anymore, because whether you're presenting for a healthcare service or you just need insurance in general, like there are now options to get enrolled in programs.
Yeah, that's what I was thinking. Thanks, Jennifer.
Yeah, that's good.
Yeah, we'll go ahead and remove that one then. Next one, knowing where the bus stops are located. Does that seem to be an issue or challenge anymore, or still a challenge?
Well, if nobody's getting any complaints about that issue, I would have been inclined to think probably it was more a problem for the other two categories than low income. But
I think especially with the new apps or the apps that are available, the smartphone stuff, low income folks, other than the ones that have lost their phone or whatnot. So this isn't 100%, but by and large, low income folks have a smartphone, and that information is available. If there's a barrier there, sometimes it's just more of an understanding barrier rather than an access to information barrier.
Okay.
I would agree.
Okay. So change it to as education, or not education, understanding.
I'm actually inclined to just remove that one at the moment, unless there's a feeling that there's some categoric need to make sure everyone knows.
Okay.
Yeah, I agree.
Okay, I'll go ahead and do that. Next one, need bus tokens passes for low income adults. There was a specific agency, I think that I can't remember who it was that made this comment, but I think they actually worked something out with City Bus because there was a program. I think you still have that available.
We do sell passes on consignment. I'm not sure if this needs a discounted pass for low income adults or if it's just availability of passes, but availability should not be a problem.
Okay, my recollection, this was more or less for availability.
So I don't know about availability, but I guess when I think of this issue, we've talked about low income people. And by and large, the low-income people, they're housed and they're kind of getting along. I think there's not that they can all afford it, but I don't see that as big of an issue as people that are in a time of transition. So if I'm staying at a shelter, I'm going to need some bus passes. But in 2 months, when I'm out of that shelter, I probably won't need that kind of support. And so I think this goes back to what was mentioned earlier. I just wonder if there's a way to really say that better in this report so that we can really point to it. But the idea that people in a time of transition, such as being in a shelter, including the domestic violence shelter, that they have access to low cost passes. And of course, as Jennifer mentioned, it's not that the agencies aren't paying for that, but I wonder if there's a way to get that provided at a reduced cost, especially if someone has got case management, there's a program that they're in. And we're not talking about people just kind of walking around not doing anything. We're talking about people actually trying to get to a better place. And it'd be good to kind of incentivize that with cheaper passes that agencies can access.
Okay. So reword it as like low-income adults who are in transition and in like shelters have access to bus passes, bus tokens passes. Would that be like a cover that?
Can we say affordable or free or something else in that too? Because I mean, they have access to them. Like if they go to the bus station, they can go get them. But can we make it a little bit more clear?
So add in affordable before bus tokens and passes.
Or instead of having this for low-income adults, that this is for programs, like if we reword it to actually say organizations that are serving those that are in transition have access to affordable, you know what I mean?
Okay.
And Doug, I think the way to look at it is it would be a nightmare if, low-income people got reduced or low-income folks in transition or whatever got reduced fare, and somehow they had to prove that to City Bus, as opposed to, you're working with an agency, you're working with the case manager that has a programmatic agreement with City Bus. It'd just be nice to kind of formalize something like that. With our program at the city, Shelter Plus Care, we do have that arrangement with City Bus, but it's because you can't be in Shelter Plus Care unless you have a disability, and so it's kind of baked in that we can offer the half-off passes. But it'd be nice to find a way to generalize that more for the other agencies.
We also have that too, Adam. But let me ask this: this isn't just about City Bus, right? So this is also for any other type of transportation in our community. So whether it's a cab or an Uber, or because I mean there are some challenges with scheduling and things. So we're not just talking about City Bus, correct?
That's
well,
a great
yes, we can actually have both.
Because I don't want to just call out City Bus because they are super, I mean, thanks, Bryce, but you guys are super helpful. It's just really expensive for an agency that our job is housing. And so we don't get money for transportation, but we are spending donor dollars, United Way dollars on transportation issues and not just to City Bus. So I feel like
something
we're all in this.
Yeah, we talk to a lot of agencies who have zero budget for transportation of any kind, and it puts them in a really tough spot. So yeah, we know it's an issue.
So I kind of wordsmith this: organizations having access to affordable transportation for patrons who are in transition. Is there anything else I should add or change? What can I do?
I like where we're headed with that one. I'm not sure that we gotten there yet.
And do you think, Adam, in transition, like, does that clearly encompass what we're going for here?
Well, depending on who's reading that line, I think people have different assumptions about that phrase.
Right.
Mm-hmm. So what can I do to improve it? Suggestions?
There's a little thinking emoji going over my head right now, but I'm trying to think.
Organizations have
Can we just say for patrons who are experiencing a crisis, or Because I don't want it to be just for people that are experiencing homelessness, because there would be other folks as well, per organizations that they're working with, that they know due to their circumstance that they need some assistance with the transportation costs. So I don't want to discount that.
Experiencing a crisis or need.
Maybe.
Yeah. So if
Or
I take the,
how about patrons who are in crisis or acute need? And maybe organizations serving, well, wait. Organizations having access to affordable transportation for patrons who are in crisis or in acute need.
I'm sorry,
I think that's more
what was
clear. Mhm. Or in acute
okay.
need.
And I'm going to jump in real quick. I apologize. I'm going to have to jump off, and I got to get to my next engagement. But thank you for doing this. If there's anything I can provide as follow up, don't hesitate to reach out. You got your two real experts in this area helping you right at the moment. So
Great, thank you.
all right.
Thanks a lot, Michael.
See you, Michael.
Bye-bye.
So there's another small part that I didn't get while I was typing. What was that again?
Organizations.
Organizations providing.
I would leave it the way it is.
Yeah, leave it and just change your actuate to acute.
Yep.
Oh, okay. and then actually put them on the APC webpage and basically that outline we are doing. And then, as Sally alluded to, the next step in this will be another meeting, and we will discuss then solutions to all these challenges. And we will again send out letters with the dates and time. I imagine probably be sometime in January at least. Give us some time to actually work on this, and then with all of the other projects that are going on, especially developing in the transportation improvement program. So that's all I had for this morning, and I wanted to thank everybody for getting through this and bearing with us, and thank you for your help. Any other comments or questions anybody would like to add?
Just want to say thank you. Appreciate you.
Yeah, thank you.
Yes, thank you all.
Thanks, everybody.
Okay, thank you.
Have a great
Thanks, Doug.
Thank you.
Thanks. Bye-bye.
This conference is no longer being recorded.